I know I act a fool, but I promise you I can't back to you. I'm just sure down for me. I want to take my whole world like a friend of mine. This little light of mine, I'm finna let it shine. I'm finna take y'all back to the better times. I'm finna talk about my mama if y'all don't mind. I was years old when you and I moved to the shop. In December, March when they gave me the code. Something that was good for my soul. Chicken soup, can I have another bowl? Your work late night, just to keep on the light. I'm the brain of so I can keep on my fight. If you can give me anything in this world, Michael Jackson is in the club and give me you know, there's no man over me. I love you for that. I'm a kid, thought you were tears in your eyes. I was looking at you and telling you that. Then I started to cry as we knelt on the kitchen floor. I said, Mama, I'm a love you, you don't hurt no more. You ain't gotta work no more. I'm gonna teach you that magic that we put in a full. See, you're unbreakable, unmistakable, incapable. Just look at what heaven do. There's an angel, and I thank you. I'm so proud of you. I'm so proud of you, and let me tell you what I'm about to do. Too loud for me. It's like a box of chocolates. My mama told me go to school, get your doctorate. Something to fall back on. You could probably but still support what I did. I feel like it's things I gotta get, things I gotta do. Just to prove you was getting through. In the quiet, please. Give me your mercy. You are so beautiful. Can't you see? You're like a Brooklyn.
Hi, everyone. I hope everyone is doing well. My name is Elizabeth. I'm a rising junior clinical laboratory science major on a pre-med track, and I attend Howard University. And I'm really glad that you all are here with us today for the 5th episode of the Health Equity Speaker Series with Aaliyah Sade. This is also going to be on YouTube. So if you want to send the link to your friends, it'll be live streaming and it'll also be available after the event. So before I get started, I wanted to share a little bit about who we are. At GlobeMed, we aim to mobilize a community of students and grassroots leaders to improve the health of the people around the world. GlobeMed students learn about health equity leadership directly from peers, our grassroots coordinators, and partners in Asia, Africa, and the Americas, and become a part of the movement of global health equity. We also believe in the power of community behind this movement, which is why we made these programs available for everyone. Additionally, these programs are made possible because of the generous support of the community. Additionally, these programs are made possible because of the generous support of the community. We'll drop a donation link in the chat for you to invest in our programming. But let me get started with introducing our lovely speaker for today. Aaliyah Sade is a student midwife, international board certified lactation consultant. She's an international board certified lactation consultant candidate, a reproductive justice advocate, global health researcher, and racial and gender equity consultant. She recently graduated from the University of California, Los Angeles with a degree in World Arts and Cultures, Arts Activism and Global Health. Her educational journey beyond college centers around reducing reproductive and sexual harm, addressing racial disparities in healthcare, and serving families locally and globally. In this conversation, she will share about the possibilities of community-based midwifery and doula care as a solution for reducing reproductive health disparities. So without further ado, I'll just give the table to Aaliyah.
Greetings, everyone. Thank you so much, Elizabeth, for that introduction. And like she said, my name is Aaliyah Sade Murphy. I use she, her pronouns. Thank you, everyone who went in the chat and shared their name, where they're tuning in from, and their pronouns. Really appreciate that. And I'm just super geeked and stoked to be here presenting with GlobeMed, and I'm super honored to be speaking with y'all. I see that some of y'all are involved in birth work or studying maternal and child healthcare systems. So I'm here in solidarity with y'all and super excited to share. As a commitment to accessibility, I want to invite y'all to use the closed captioning option below. And I believe that someone will start sharing the presentation. Let me know, maybe give me a hand if y'all see the presentation being shared. And I see some folks here from Chicago, Boston, Los Angeles, Baltimore. Super exciting. Elizabeth, do you have my slides to share by any chance?
Yes, I'm going to share them right now.
Okay, thank you, love. But yeah, today I'm going to be talking about consent and Black maternal care. And I really want to center that care part right there, rather than saying like health or, you know, mortality or any of those things, but care, because I feel like as, you know, an aspiring midwife, a student midwife, our model is really centered around care. And like Elizabeth said, I'll go into my introduction later, but I do want to invite y'all to look at this agenda so you just have an idea of where we're going today, what we're going to be doing for the next hour. We're going to start with some introductions of myself, and I hope that y'all would continue introducing yourselves in the group chats. And then we're going to jump into a conversation around Black maternal and infant mortality in the United States, the importance of midwives and doulas and consent in the medical model. And lastly, we're going to have some space for conversational Q&A. And I just want to give y'all a little warning that we're going to be watching some videos together to really form a solid understanding of everything that I'm going to be sharing about. And I just want to, you know, let y'all know that if you want to keep your camera off, that's cool. If you need to step away for a moment, that's cool. Do whatever you need to do to take care of yourselves. So just to introduce myself, thank you so much, Elizabeth, for that introduction. I'll try not to be redundant. I am an Afro-Indigenous, Black and Mexican woman from San Diego, California, which is originally Kumeyaay territory, still Kumeyaay territory. I use she, her pronouns once again. I'm a survivor, racial and gender equity consultant, global health researcher. I'm a full spectrum doula, so I work with loss, abortion, postpartum, birth, sibling doula, all the things, anything that can support a birthing person through that journey, I'm there. I'm also a yoga instructor and a student herbalist and student midwife. I've been super passionate about justice and have been an activist in my community since I was 14 years old. So that's going on 10 years now. And I recently graduated from the University of California, Los Angeles with a degree in World Arts and Cultures, Arts Activism and Global Health. And my passion for health equity has really followed me throughout all of my travels in the world. It's followed me into my research. I really centered it around justice, as well as my lobbying. You know, when we could go places in person, I was up in Sacramento lobbying for reproductive health care. I was talking to the dean of my college, all the things. And this passion has really, like, at the end of the day, been for my community. My education is for my community, and this care is for my community as well. And these pictures just show me at a protest, a selfie, and me with my younger sister, which was the first natural birth that I ever saw. And as we talk about Black maternal health and consent, I want to invite y'all into acknowledgement of the land. I did share earlier that San Diego is originally Kumeyaay territory, and they are the past, present, and future original caretakers and stewards of this land. And I want to invite y'all, everyone was sharing where they're watching from, you know, do some research and see who the original caretakers and Indigenous folks of the land that you are on are, and investigate ways that you can be in solidarity. Also want to acknowledge that all of the information that I shared today was not invented by me. I didn't dream it up one day. I come from an intellectual lineage of Black midwives and birth workers that are community-based, as well as studying at my college. And I've been super privileged to learn from Black birth workers such as Kimberly Durden, Shafia Monroe, Jenny Joseph, Darnay Blount, Dorothy Roberts, and Saida Pepra, amongst many more. And I really want to acknowledge the labor that birth workers of colors are doing every day on Instagram and Facebook and these forums, and just really like shout them out. And also, it's not lost on me that our entire medical industrial complex and modern maternity care were built on the exploitation and experimentation of Black women's bodies, of enslaved African folks who were brought here. So not only this, but all that generational knowledge that was stolen and lost, and that we were told, and by we, I mean like us Black women, we were told that we couldn't go to medical school, we couldn't go to midwifery school, we couldn't even go to college. So a lot was lost in that time period of 300 plus years, 400 plus years. And I really want to ground this conversation in acknowledgement of what happened and all of that knowledge, right? That's part of my DNA. And I want to invite y'all to be open to possibilities. I know that many of us are United States-based global health students and professionals, and we tend to look at health inequity in terms of statistics or social determinants of health. And I want to invite y'all to return to the heart of the matter, right? And raise our awareness of the ways that racism and obstetrical violence disproportionately impact health outcomes of Black birthing people. Just a little note, I'm gonna use women and birthing people interchangeably because I do wanna be inclusive. Even if you are not a Black or a birthing person, I wanna encourage y'all to deepen your understanding of yourself. Even if you are not a mom, everyone here in this Zoom call and everyone here that's watching, everyone that will watch was born, everyone has a mama. And it's like until Black birthing people, until Black women and their babies are receiving competent care, then nobody really is, right? So we wanna be in solidarity with those who are most disproportionately impacted. And lastly, I want to invite y'all to acknowledge your body, mind, and spirit during this conversation. I will be referencing violence. I will be referencing, violation of consent that happens in the medical industrial complex. And I want y'all to take care of yourselves. If something is coming up in your body, feelings and emotions are really good information. And you can tune back into YouTube and watch this talk later on. You don't have to stay in this Zoom call or on this YouTube video if it's bringing up something for you. With that said, let's jump into the definition of a midwife, just so everyone is on the same page. So a midwife is a professional in obstetrics. The midwife is the person who provides care to women birthing people during pregnancy and birth. Some midwives also do primary care related to reproductive health, including annual gyne exams, family planning, and menopausal care. So the full spectrum of reproductive health, we're there. Many developing countries are investing money in training for midwives and other community health workers so that they can provide well women primary care services that are currently lacking, because worldwide there's a shortage of primary care providers and midwives could fill that gap. Next, I want to talk about doulas. Just so everyone has an idea of what a doula is. So when I think of a doula, I think of a non-medical care provider, right? Because we're centering care, and doula-ing, making it into a verb because it is about an action, is the act of educating, loving, respecting, listening, embracing, advocating for, and assisting a woman, birthing person prenatally during labor, childbirth, and beyond. So with that said, now that we're all on the same page, we're going to watch a video together about the racist roots of reproductive rights in the United States.
Birth control is amazing, but only if it's what you want. Low-income women of color are more likely to be pressured by doctors to use contraception than white women, even if it's not their preference. But this is nothing new. In the early 20th century, birth control gave women a newfound freedom over their bodies. But the reproductive rights movement was quickly co-opted by eugenicists, who believed they could improve the country by lowering the birth rate of the so-called unfit. In other words, sterilizing poor women, women of color, and those with disabilities. Even Margaret Sanger, the founder of Planned Parenthood, used eugenics to justify birth control. She thought society would be better if so-called unfit people had less babies, even if her intentions were good. Eventually, 32 states adopted mandatory sterilization laws. In the 1930s and 40s, North Carolina sterilized about 8,000 developmentally disabled people without their consent. Roughly 5,000 of them were Black. By the 1970s, 70,000 people had been forcibly sterilized across the US, including 1/3 of women of childbearing age in Puerto Rico and nearly 1/4 of Native American women, which caused some smaller tribes to face near extinction. In 1978, the government moved to limit the use of federal funds for sterilization, but coercive practices have continued. In the early 1990s, judges in several states gave women convicted of child abuse or drug use during pregnancy a choice: use Norplant, a contraceptive inserted in the arm, or go to jail. And from 2006 to 2010, nearly 150 women were sterilized in 2 California state prisons, 1/4 of them against their will. Even today, doctors are still more likely to tell low-income women of color to have fewer kids than middle-class white women. At what point will the fight for reproductive rights be inclusive of all women?
So let's just take a quick breath because that was a lot of information. And I shared this video. A lot of the information from it is actually from a book called Killing the Black Body by Dorothy Roberts, which was published in 1990, I believe. So this has been common knowledge for a long time, but in 2021, we're seeing an increased attention turned towards the racist roots of reproductive health care in the United States. We saw Vice President Kamala Harris talking about it during Black Maternal Health Week. And I shared this because I really want to stress that what is happening with Black women and birthing people in our healthcare is not separate from the history of health outcomes for Indigenous, LGBTQIA+, disabled folks, and immigrants in the global community. And I wanted to stress that racism plays a huge role in legislation and models how care is given and who gets care and who doesn't, and who has choice and who doesn't. And I also want to stress that Black maternal mortality is a global issue. And we see in every country that the closer one is to Blackness, the more likely that they are to die during childbirth and not have agency in their reproductive lives. Which brings me to talk about consent. And if y'all have any thoughts about that video that was shared right now, feel free to put them in the chat and I'll definitely try to get to them. But I want to share about consent. And right now we see a very popularized image that references to Dr. J Marion Sims, who is known as the founding father of gynecology. And he earned his title through the contributions made by experimenting on enslaved Black African birthing people, women. And there was a power dynamic there where the Black folks who were involved in his experiments were seen as his property. So they didn't get no anesthesia. They didn't have the power to say yes or no. They were really viewed as research subjects. And in the United States, we see this legacy still continuing on in maternal care or reproductive health care. This legacy of not getting consent and seeing Black bodies as experimental bodies. And we see that pregnancy and birth are treated as a medical condition instead of a normal life event. And insurance companies make a lot of money from hospital births, especially if they are surgical births using many interventions. Both culturally and economically, the standard of care in the United States is to receive in-hospital care if you are pregnant or if you're giving birth. But we have to acknowledge that this whole institution of obstetrics and gynecology was built on the violation of Black people's bodies and the theft of Black midwives' knowledge. And we know from the statistics of Black women and babies that something is very deeply twisted and wrong with the medical industrial complex. And these things that happened throughout history and that continue to happen today, especially during this pandemic, where a lot of birthing people aren't allowed to have support people in the hospital with them, are based in a model of care that doesn't center consent, that doesn't center people, that doesn't even look at patients as people, but instead looks at them as research subjects to make statistics about, for people to study and be like, I don't know why all these Black people are dying during childbirth. But the clear answer is racism and is that long-standing legacy of violation and obstetrical violence. And when I talk about consent, I want to be really clear. And we have this beautiful graphic from Planned Parenthood. And if you caught that comment earlier in the video, it does say that the founder of Planned Parenthood was a eugenicist. So that's not lost in me. And I do want to definitely acknowledge that even as I'm sharing this resource. But this resource kind of frames consent as fries, right? Everybody loves fries. It's freely given, it's reversible, it's informed, it's enthusiastic, and it's specific. A lot of the times in a hospital-based setting or in a clinic-based setting where the doctor or nurse is seen as the expert and birthing people or women are seen as like the patient that's having a medical emergency, they don't have the power or agency to really truly give consent. It's not free to give. For instance, if someone doesn't want a certain medical intervention done on their child or themselves, someone might call the Child Protective Services on them. So that is not freely given, that's coercive. You can't reverse many times consent that's given in a medical context unless you go through a lot of paperwork. It's really hard to be enthusiastic when everyone is treating you like, if you don't do this thing that I want you to do, then you're gonna die. And I really wanted to kind of talk about consent in the context of reproductive justice, because reproductive justice it requires consent to work. And in our next slide, we see this beautiful graphic that kind of shows that reproductive justice is all encompassing. And I'm going to get to the definition of reproductive justice, but I do want to say that environmental justice is reproductive justice, immigration justice is reproductive justice, disability justice is reproductive justice, decolonization is reproductive justice, the return of midwifery is reproductive justice. All of these things are kind of lumped in. And I want to give y'all kind of like a peek into the history of reproductive justice with a short video that will kind of talk about where it comes from, what it means, etc.
Reproductive justice. A lot of people talk about it, but many don't know what it really means. Here's the basic idea. Coined by 12 Black women in June of 1994, the term is the combination of two phrases, reproductive rights and social justice. The new phrase reflected the lives and experiences of Black women in the United States who had been denied a full range of services and protections. Black women have multiple identities, like age, ability, sexual orientation, immigration status, religion, and nationality, just to name a few. Consider the fact that Black women experience some of the highest rates of poverty and only make 63 cents for every dollar a white man makes. Nearly 20% of Black women have no health insurance, and die 4 times as often as white women from pregnancy-related causes, regardless of income or educational status. The issue at play here is intersectionality, a term coined by legal scholar Kimberly Crenshaw, which refers to how multiple systems of oppression work together. Reproductive justice is how we take on all the systems that harm us. Reproductive justice is the human right that can only be achieved when all women and girls have the complete economic, social, and political power and resources to make healthy decisions about our bodies, our families, and our communities in all areas of our lives. Reproductive justice centers the leadership and lived experiences of the most vulnerable, including but not limited to Black women, women of color, LGBTQ people, and youth. So there you have it. Reproductive justice has given thousands of women a framework to change policy, improve services, collaborate with other social justice movements towards our collective liberation. For more information, contact In Our Own Voice at www.blackrj.org. Thanks for watching, and welcome to the movement.
So welcome to the movement, y'all. I know that was a lot of information really fast, but if you want to know more about reproductive justice, you can look up Sister Song on Google. And it really is a powerful framework for thinking about how to recenter the most vulnerable and how to recenter consent and care. And it's really like a guiding light in the midwifery care that I want to provide in my career. But I just want to make sure we all had a solid understanding of that. Feel free to comment in the chat if you have any questions about that video, but I'm gonna keep on moving because now I want to talk about Black maternal and infant health disparities, because this is a health equity speaker series, and there's a lot of inequities going on with Black maternal and infant health. And every day the world is shifting and the conversation is growing and becoming more mainstream and central to the work of healthcare. We're seeing that folks have to do implicit bias trainings now. It's like federally mandated that healthcare providers are doing these trainings because implicit bias plays a huge role in the experiences that Black mothers, Black birthing people, Black infants have, Black families have. And we will kind of see some more videos about this later, but I do want to put the statistics out there, and I don't want to put it out there as a like shocker or, you know, like some type of like, please pay attention to this. But I do want to just offer them because this is a really urgent issue, and it's always been an urgent issue. Black birthing people / Black mothers are dying around the time of birth and pregnancy, up to 3 to 4 times more often than white parents and birthing people and mothers. And Black babies are dying at a rate twice as much as white babies. So that means that, you know, I'm a Black woman. That means my sisters, my aunties, my neighbors, my mother, and myself, we are dying trying to bring life into the world. And as much as this is my work and my education, it's also very personal, and it's also very inseparable from my conception of history and my conception of what's going on right now and the future possibilities. And this is, you know, reproductive justice and injustice. This is one of the many legacies of the United States history of enslavement and displacement of African folks, as well as other folks from communities of color into the United States, as well as the eradication of the Black midwife, which I'll kind of go into a little bit more in a bit. And I want to show y'all this beautiful poem that talks about health inequity that I feel like really relates to what's happening to Black women when they go into the hospital.
My grandmother tells a story of hospitals in her day. One of barriers, one of trauma, one of fear. When we are sick, she pulls remedies from a tattered notebook, recipes passed through generations of those misunderstood by the world around them. She ensures this cold, this ache, this fever will break by morning. All we need is this prayer, this herb, this belief that better days are coming. She doesn't speak of bad health. She says with stern eyes, only speak life, a lesson, a warning, and a hope in one. packaged words birthed from a time when healthcare didn't look like help for us. I feel this chill down my spine when I am ill, when my only option left is a doctor's office or the never-ending maze of a hospital. The fear that there will be assumptions about who I am, that things will be ignored like culture and beliefs, that I won't be heard, that history repeats itself. Fear that these hallways will be the same broken roads instead of bridges to new understanding. I envy those who don't have to sit with crossed fingers hoping, envy their peace of mind and comfort. All anyone wants is to be understood, to be heard, to be told that help is actually on the way.
Thank y'all for watching that with me. If we were in the live spoken word space, I would be giving it all the snaps, and I hope that y'all are too. I just want to share this because it kind of speaks to how health inequity is, it even transcends like reproductive health care and maternal care, right? We see in every statistical thing, whether it's diabetes, high blood pressure, stroke, like Black folks in the United States are always that line that's just like separate from everyone else that's experiencing these chronic health conditions at a higher rate. And it just makes you think, is it really about the individual choices that people are making, or is it about the system that is happening within? And according to Shafia Monroe, who is a world-renowned doula trainer, author, scholar of public health, and midwife, some of the common causes of lethal health inequities are ignoring Black women's plea for medical attention, the unconscious implicit bias against Black women, dismissing the healthcare needs of pregnant and postpartum Black women, not believing Black women when they say something is wrong, and allowing Black postpartum mothers to die. And she also says that one of the darkest moments in the United States history was the systematic eradication of the African-American midwife from her community, resulting in a legacy of birth injustices. Because if we had more Black midwives in communities, it's only 6% in the whole United States of midwives that are Black. If we had more Black midwives in the community, then we wouldn't have to be thinking about these issues that she already listed before of ignoring Black women's plea for medical attention, that unconscious bias, and allowing folks to die. You don't allow your sisters and aunties and cousins and neighbors to die. But when you're disconnected from the communities that you work with, then that's going to happen more often. And I do want to say that midwives, and specifically Black midwives, are the original gynecological healthcare provider in the United States. Indigenous midwives have been doing this work since this land has been here. And we've played a critical role in improving the care and outcomes for Black families and beyond. Before the physician was even a specialty in obstetrics, before that was a thing, Black midwives were providing maternal care for enslaved Black folks, for white folks as well in the United States. And at the same time, Black midwives have also faced extra, unnecessary, and often extreme challenges to practicing and serving the families in need of their care. Folks have been imprisoned because of being midwives. So it kind of shows how reproductive justice also requires abolition, right? It also requires, if you believe in that, criminal justice reform. It also requires to move beyond this like punitive system that we have into something more transformative and restorative, and to return back to that original care provider. And that brings me to talk about birth justice. And birth justice is similar to reproductive justice, but more centralized, and goes beyond just talking about, in my opinion, it goes beyond just talking about like cis hetero identifying, like presenting women. It really starts off with saying we believe that birth justice exists when women and trans folks are empowered during pregnancy, labor, childbirth, and postpartum to make healthy decisions for themselves and their babies. Birth justice is a part of a wider movement against reproductive oppression. It aims to dismantle inequalities of race, class, gender, and sexuality that lead to negative birth experiences, especially for women of color, low-income women, survivors of violence, immigrant women, queer and trans folks, and women of the global South, right? That thing that I was referencing earlier, like this is a global issue. Working for birth justice involves educating the community and challenging abuses by medical personnel and the overuse of medical interventions. It also involves advocating for universal access to culturally appropriate women-centered healthcare. It includes the right to choose whether or not to carry a pregnancy, to choose when, where, how, and with whom to birth, right? So to have that option of even having a Black midwife, of even having an out-of-hospital birth. It includes access to traditional and Indigenous birth workers, such as midwives and doulas, and the right to breastfeeding support. And here we have this image that says birth justice is social justice, because how we are born matters and what options we have in our reproductive health matters. And it has long-lasting health impacts, how someone is born, when they're born, who they're born with. And I kind of want to switch gears and talk about the possibilities of Black midwives and what Black midwives are doing. This video is going to feature Kimberly Durden, who was the first Black midwife that I met, who trained me to be a doula in Los Angeles when I was in college. And she's going to talk a little bit about, you know, everything that I've been referencing and what this birth justice can look like. Like, what does this, you know, idea look like when it's played out in reality?
Everyone who is coming into the situation to bring a child into the world has a totally unique and different set of circumstances. When you're about to have a baby as a person of color, you're also traumatized by the fact that you're more likely to die, or that your baby's more likely to die or have a problem. The disparities that I see in Black and brown Indigenous communities and non-gender conforming communities, are communities around birthing have been fragmented. Folks are just not able to access care. We have a trust-mistrust relationship with care providers. In the way that the maternal health care system is set up, require physicians to see lots and lots and lots of patients every day. Sometimes 5 minutes a prenatal visit is all they get. It's not enough time, in my opinion, to give adequate care. There are many wonderful providers that really want to give more and really care about their patients. Something that we need to do in our system is figure out how we can individualize care, how we can have more shared decision-making. Anywhere that midwifery is ingrained into the mainstream healthcare system, the better outcomes mothers have, babies have, across all groups of society, socioeconomic levels as well. Our organization is about providing resources, about training more professionals, training more people that look like me, because we do know that we need more birth workers of color to kind of be able to match the population that's suffering the most in the healthcare system. Just being able to sit with people, to witness people on this journey, to give them a sense of hope, to help them feel like they have the power, that they can go out and make changes. Since the beginning of time, we've always needed help birthing our children. We need a tribe and we need a community to give us support. I really, truly believe that we were never meant to do this alone.
So that's Mama Kim. She's amazing, as y'all can see. That space that was featured in that video is actually a birth center now. There are only 13 Black-owned birth centers in the whole United States. And one of them is in Los Angeles called Kindred Space LA. But I really wanted to share this video because you can kind of see in it that there was a space where Black birthing people, Black birth workers could feel safe together and start to reimagine the possibilities and return to that midwifery-centered care and really integrate it into the medical model that we have now. Because one thing I do want to say is that Black midwives in general, are the experts in normal physiological birth, but we know that there are high-risk pregnancies out there, and we do need doctors and surgeons to be a part of that care. But with midwifery care kind of integrated into the system, we could have better healthcare outcomes. It can be longer than a 5-minute appointment. Instead, it's going to be a 45-minute appointment. And you can figure out what's really happening in someone's life. What type of stressors do they have that could potentially be curbed, or really get a insight into their diets. Maybe even encourage them to breastfeed, which is one of the best things that you can do for a child and for a birthing person after giving birth. And I know that these statistics have been repeated again and again, but I really want to make it clear that Black midwives save lives. I know sometimes when folks think of midwifery, they think of the beautiful water birth and the hippies from the 60s and 70s and this like radical feminist, I want to be outside of the system, I want to get this alternative crunchy care. But I want to make it clear that in the communities that are most vulnerable, midwifery care is really out here saving lives. It's changing health outcome, it's changing statistics, those statistics of Black women dying 3 to 4 times more than white women, and Black babies dying. And that's one of the possibilities of midwifery care, of midwives that look like their communities. And since the 1960s and 70s, we have really seen a resurgence in the popularity of midwives, but oftentimes midwives are not available to the people who want them and need them the most. But it is being recognized as a viable, safe, and good option for most people. And actually, since the beginning of 2000, around the time when some of us were probably born, the number of midwife-attended births has been steadily increasing in the United States. In almost every other country in the world, the midwife is the frontline care provider for pregnant folks. And alongside this, a lot of organizations have been working to increase the presence of Black midwives and access to these midwives. So we see across the country, for instance, Healthy Start programs. That's a national program integrating midwifery care and doula care into their model. So participants can receive free midwifery care or free doula care, because sometimes the folks who need it the most cannot afford it. And there's also been a well-demonstrated, well-researched, and proven need for more healthcare professionals that look like their community and that understand the needs of people of color, of Indigenous folks, of LGBTQIA folks on more than a book level, more than I did a 1-hour implicit bias training level. Like, we need folks who have the embodied experience and understanding and cultural competence to be working with families. So to put it simply, when Black families, when Black babies, when Black birthing people, when Black mamas are cared for by Black health professionals like Black midwives, they are often better heard, better seen, better respected, better understood, and they get their needs met, which directly relates to better health outcomes. Because one of the biggest part of health inequity is not being listened to. And I want to talk about so how are we doing this? How is it that we're able to listen more? How is it that we're able to see people? How is it that we're able to have these 45-minute appointments? I want to say that was the original way that things were done, right? It's not the alternative, it's the original way. The original way, since the beginning of history, if you think about what was the oldest job, a midwife had to be it, right? The oldest model of care for pregnant folks was to monitor the physical, psychological, and social well-being of a parent throughout their childbearing cycle. So that's not just starting when they get pregnant, but that's starting at someone's first bleed, like when they first get their menstrual cycle, educating them on their how to track their cycles, how to track their fertility, how to know when they're going to get their period, outside of like having an app, outside of I'm going to, get on a hormonal contraceptive to regulate things, but really increasing bodily autonomy in young people, providing the mother or birthing person with individualized education, counseling, and prenatal care, continuous hands-on assistance during labor and delivery and postpartum support. So what that looks like is not just giving every parent that comes in through the clinic or the birth center the same handout that you give to all your other patients or clients. You're really going to listen to them, see what their needs are, and respond, within scope of practice in a really individualized way. You're going to have shared decision making. You're going to have informed consent. You're going to be able to meet people where they're at. A lot of times what happens in medical spaces is that people will speak in almost a different language when they talk about what's going on with someone, and not make sure that person understands, and not make sure that they feel that they are an active participant in their labor or in their pregnancy. Whereas midwives are kind of there to, guide you and keep you safe. But at the end of the day, it's your decision how you want to do things. We minimize technological interventions. So a lot of the interventions that are commonplace in modern mainstream pregnancy, delivery, and postpartum are unnecessary. And we know this because for many centuries, people were having their babies without continuous fetal monitoring. They're having their babies without all of the pharmaceuticals. And we know that a lot of these pharmaceutical companies, they have stocks, right? They make a lot of money off of making these interventions the standard of care and commonplace. And a lot of insurance companies, they cover these pharmaceuticals. So a lot of the interventions that are included in a normal, traditional like hospital birth are not necessarily evidence-based to provide a safer experience, nor are they, proven and tried and true. Like, people still don't know the impacts of Pitocin on breastfeeding, for instance. Like, that has been around for a very long time, and there's, very limited evidence. So midwives really kind of stick to the original way of doing things unless an intervention is needed. And at that point, we can do an IV, we can suture, we can, prescribe certain medications, but it's only as needed, not the common standard care that we're going to do immediately, even if the person doesn't need or want it. And we identify and refer folks who require obstetrical attention. So like I said earlier, midwives are the experts in normal physiologic birth. So when we see something going outside of normal, for instance, we see some high blood pressure, or we're seeing that someone's leaking protein into their urine samples, that's a moment where we might get a physician involved. That's a moment where we might send them to do some more labs. And we're really, really good about catching those things early rather than catching them barely like at the end of the pregnancy and someone's going into preterm labor. We try to be proactive. And this model, the midwife model of care, has really been proven time and time again throughout history to reduce the incidence of birth injury, birth trauma, and cesarean sections. And I don't want to make it seem like cesarean sections are bad. When someone needs a cesarean, they need a cesarean. When someone needs surgical birth with forceps or vacuum extraction, they need that, and that saves lives. But oftentimes in some of these developed countries like the United States, like Brazil, you'll see that these interventions, specifically surgical interventions, are used way more than necessary, and they're creating more harm than good. And I want to talk about the possibilities of Black doulas, because not everyone is going to want a physiologic birth. Some people are like, yeah, I want an epidural. I want to go to the hospital. I feel safer there. And for those folks, they can, of course, still get supplementary midwifery care and be able to experience those 45-minute appointments and really get that thorough person-to-person interaction with a care provider and just have a second opinion on everything. And they can have a doula who can go with them to the hospital and be there if they want a natural birth in the hospital, if they have to be in the hospital for some reason, or if they have a planned cesarean. Doulas really work in the out-of-hospital setting, in the hospital setting. There's even like hospital-based midwives, nurse midwives who work in hospitals. A lot of labor and delivery nurses have doula trainings. And when there's a doula in attendance at a birth, 25%, and these are what the studies have shown, 25% of the births have shorter labor. They have a 60% reduction in epidural requests, 50% reduction in the cesarean rate. That's huge, 50%. 40% reduction in oxytocin use. That was the Pitocin that I was referring to earlier. And 40% reduction in forceps delivery. That's another form of surgical delivery. 30% reduction in anesthetic use, right? So doulas make a big impact. And there was actually a study that showed that it's not even about what the doula is doing, right? You don't have to do all the fancy things and bring all the little massage rollers and all of that, but just having someone there in the room with you, continuous labor support, because if you are in a hospital, typically you have nurses coming in and out, doctors coming in and out. If you have someone who is continuously there with you, it was shown that all of these interventions were decreased by that much. A lot of folks ended up having vaginal deliveries or natural births. So doulas make a huge impact. And again, we're seeing a lot of community-based doula programs popping up all over the country because people are starting to recognize and remember that birth and postpartum and pregnancy deserve and require our attention and care and supports. And investors are funding these programs because they see their value. So in the next slide, I kind of just wanted to share some photos, or just 2 photos, from what this looks like in my community and like the work that I'm doing. So I am a student midwife at a birth center here in San Diego. And we work with a program called PCI, Global Communities, which has a Healthy Start program, which means that folks that are planning to, deliver in the hospital, or even if they're getting midwifery care, as long as they're Black, as long as they are low income, as long as they have one of these indicators, they can get supplemental midwifery care. They can come into the birth center, they can see us. We can be there to catch their baby, or we can come see them after their hospital birth, because right now a lot of doulas and other support people are not allowed in these hospitals. But we have a all Black staff at the birth center. So we have 2 Black licensed midwives, and y'all will see them in a video later kind of talking about the work that they do. And you see myself and another student midwife to the side, and you see a beautiful Black mom smiling because she's happy that she just had her baby, and she had it with the support of Black birth workers. And then you see another picture to the side of me carrying a baby. And that baby was actually born from one of our parents that we work with that is from Haiti. So we work with a lot of folks who are immigrating into San Diego because this is a border town. And we have folks who are from all over the diaspora who come into the birth center, and I'm there to help interpret for Spanish speakers and make sure that it get that culturally competent care. And I just want to share this video of my preceptors with midwifery school. You really are, as soon as you start studying, you are also doing hands-on work, and you're learning from midwives, and you're doing the vitals, and you're doing the urine dips and all of the things that are involved in care. You're involved in that from your first day of school. And these are, my midwives and my preceptors talking about the work that they do with this PCI program and the work that we're doing in our community.
The least likely to actually have a midwife due to access or systems not having them be a part of their care. And so PCI wanted to be the trailblazers here, and let's have midwives take care of our participants and be involved in this care. And we feel like that is making the biggest difference in our outcomes. And for us, our outcomes and bottom lines come down to decreasing infant mortality rates and decreasing maternal mortality and morbidity rates. The very first families that was actually within the program. This particular mom was a military mom. She had already had one son. And she said she had nothing but white care providers and felt like every time she would talk to them and say like, this is what's going on for me, that she wasn't being heard, that they would dismiss her, and she was devastated. 6 years later almost, and she's pregnant again. She's like, I'm making a new plan. I'm gonna find me a Black midwife. I show up and she's just like, whoa, this baby's barreling through me. This was a game changer for her. It healed her trauma from her previous birth.
And it was a really important opportunity for these PCI clients to really be able to see someone who looks like them and provide that care for them and the difference that that can make.
And it's important to me to continue training other Black midwives so that we can continue to have more Black midwives taking care of more Black families and that they have other people that look like them. And so there's a cultural competency to their care. They feel like they can say whatever they need to say and that they feel like their provider is understanding where they're coming from. That is a big part of it.
Huge.
I feel like you get way more holistic healthcare by being a participant of the PCI program. It really feels like this work is what I was supposed to be doing. This has always been my goal, is to take care of Black families, Black communities, Black immigrants. And I feel like I can really see the impact of the work that PCI is doing in collaboration with us, in collaboration with For the Village, and that it's necessary and absolutely 100% needed. Because if it's not us, then who? You know, who's going to be caring for these moms and these babies?
Right.
So yeah, love PCI.
So that was Nikki Helms, licensed midwife, certified professional midwife, and Darnay Blount, and they're amazing. And Darnay has been doing this work in San Diego for 20 years now. So the birth center that they have now is actually a merger with a birth center that she had operated since the early 2010s. So there has been this option for folks in San Diego to get this Black midwifery care for quite a while compared to some places, you know, considering that there's only 13 Black-owned birth centers in the entire country. But I really just wanted to highlight them because they are my teachers. And they're amazing and they're doing really great work down here. And they are the possibility that I imagine, right? So when I imagine this, what does it look like to have like midwifery care integrated into the healthcare system and the social services system? They are that. They're doing that work with PCI Healthy Start. I question, what does it look like when Black families can have a healthcare provider that looks like them? And that is them. And they really embody that and model that for me to learn from. And yeah, I just wanted to share the work that they're doing and also invite y'all to get involved with supporting Black maternal health. Some ways that y'all can get involved are, you know, by, if you are a person of color and you're called to be a birth worker or you feel called to be a midwife and you're interested in reproductive health, get involved. Now is the time. It's urgent. It's necessary. It's essential. Now more than ever. I don't want to say we're coming out of the pandemic, but during this pandemic and whatever is going to happen after, we need more Black birth workers. We need more birth workers of color. We need more queer birth workers. And if you want to learn about becoming a midwife, I want to encourage y'all to visit the Midwives Alliance of North America. And y'all can also find a list of scholarships for birth workers of color through the Grand Challenge website, which you can also research. And then there's also some resources through the American College of Nurse Midwives in case you wanted to, you know, have that scope of practice that also allows you to work in the hospital. And you can also look up Black-led doula trainings. If you are not quite interested in this yourself, or you see yourself like going the physician route or whatever it is, I want to encourage y'all to look into the National Black Midwives Alliance and kind of learn about, you know, who your colleagues are going to be going into the medical field. Look into the National Association to Advance Black Birth. There's a lot of resources there. Sister Midwives Productions, Black Mamas Matter Alliance, Sister Song. Olivia put in the chat the Birthing Project USA. Yeah, that's 30-year-old grassroots Black maternal health and care organization. Thank you so much for sharing that. And there's a plethora of more ways to get involved. If you know a Black birth worker or you know a birth worker of color, Venmo them, support them, because sometimes this work is not done for money, right? We're doing this because this is hard work. We're doing this because our community needs us to. If you see a Black owned birth center that's trying to be built, donate to those, and really like redistribute those resources if you have the privilege to. And I just want to share my references. There's a whole bunch of them, but y'all can find all these videos if you want to watch them again on YouTube. And with that, my presentation is over, and I want to invite y'all to turn on your cameras if that feels good, and let me know what landed for you from this presentation. What thoughts, questions, ideas do you have? Or maybe just a check-in. How are you feeling?
Hi. My name is Justice. I already did like kind of my intro on the like thing, but basically maternal and child health education major, attending Howard University. I want to be an obstetrician and gynecologist and a health education specialist. So that's where I'm at right now. And so right, HU. Okay, so but like this presentation was very informative and inspiring, and I really thank you for taking the time out and just taking the time out and the energy to do this, because I do understand that this is just a lot of hard work and very straining and emotionally and physically hard work, and you definitely portrayed that in your presentation, so I thank you for that. And so this really, it's just everything resonated with me. It kind of gives me more insight to what I can do. Like right now, since I am an undergraduate and I'm taking an enrichment year before I go to medical school. So I definitely have a lot of organizations and programs to look at and things that I can do now, even though I'm not like certified yet, but there's ways that I can still make an impact and like inspire change and work. So I just thank you. Everything resonated with me. So yeah.
Oh, that's so good to hear. And I'm so happy that you're on this call from HBCU and you're going to be like an obstetrician. That's huge. You're going to go to medical school. Like, I'm so, so proud of you. And I just want to say, like, you are the possibility, right? You're going to change all these statistics just being present. And there's so many ways to get involved. Even if you know that you want to go down the physician route, you could easily get involved in a birth worker training or become a childbirth educator. Just like start doing things even while you're an undergrad, and maybe even like figure out who the Black midwives in your community are, because you could probably start witnessing some births before you even get to medical school if you work as a doula or just shadow a midwife. But yeah, I'm so proud of you, and thank you for being present and super involved.
Thank you. Have a great day.
You too.
So with that, does anyone have any questions for Aaliyah?
Is there anyone else here that wants to be an obstetrician? Maybe like just put a little hand emoji or a little heart emoji.
I want to be a physician. I don't know yet. I am in a maternal health lab, so that is a very big option for me, but I don't know yet. So it's like a half hand up.
Maybe they have a volunteer doula program near you, so you can see how the physicians kind of work in your area.
Yeah, being part of the lab, I would say, has been like super eye-opening. Like I was never really interested in like maternal child health before becoming a part of the lab. And since then, it's so important to me. Like it's changed. I remember like being in like middle school and we would talk about like how we want to give birth. And I was like, I want to have a C-section. Like I can't imagine even pushing a baby out. And like, since being in the lab, like my whole like lens and view of birth has changed completely, and talking to midwives and talking to doulas, it's just been really, really amazing. So I would say, like, anyone, even if you're not interested, if you're going to be a birthing person, you should look into midwifery and doula care as an option for you.
I just want to echo that. Please do. We want to see you. And we also do well person care. So, if you just want a pap smear, you could always go to community midwife and get that done. If you want your blood drawn, you can go to community midwife and get that done. So it's full spectrum. Does anyone here know if they were born with midwives or if they were born in a hospital?
I was born in a hospital, but I have lots of midwives in my life. My cousin's partner is a midwife. I have lived with a midwife as a roommate, and a good friend of mine is actually she's a Black doula as well. So it's wonderful to find out ways to support, to give further support to that.
It's all around you. The birth work. I feel like most people, at least I'm assuming that a lot of y'all are in a similar age group as me. If you're in college or recently graduated, were born in like a hospital, because it's pretty much like the standard in the 90s and early 2000s. But we're seeing like now, for instance, during the pandemic, I feel like a lot of people are like, I'm not going there because I can't have this person with me. I can't have my whole crew with me. So we're going to have this baby at home, or we're not going to have it, which has been really cool to see. And yeah, I'm like, India said, I was also born in a hospital. I was born in a hospital as well. And my mom always tells me that there were like 12 residents there and they all watched my birth. And I always think that's really special. I'm like, oh, I was like education for them. And that's really like what I want to do one day. But yeah, just wanted to ask that, because even if you don't plan on giving birth one day, like everybody was born, and how you're born matters. But yeah, does anyone have any questions or comments? Or anything that was challenging to see in the presentation? Anything that you're like, I don't know about that? Sarah said, I really appreciate how you spoke about doulas being the original birth workers and how Black women are the foundation for our knowledge of gynecology. Oh, thank you for that affirmation. And, that is something that a lot of my elders say. So those words are I'm just a vessel for those words. And I really resonate with them. And I think it's very true that midwifery care is the like original care rather than the alternative. And I'm so grateful for everyone that came onto this call. If you want to learn more about the birth center that I work at, you can find us online at sdcommunitybirthcenter.com. If y'all want to stay in touch, my Instagram, I'll put it in the chat. It's just my name. It's the Aaliyah Sade. And sometimes I post about this stuff. So I'd love to connect with y'all and get to know y'all. Thank you for joining.
I just want to echo that. And I want to thank Aaliyah again so much for joining and sharing her story and her path to birth work. It was super informative for me, and I know it was such a beautiful space to be in. I want to thank you again for sharing your expertise. And I also want to say that our next Health Equity Speaker Series will also be centered around birthing, which I'm really excited for, but in a different lens. So it'll be really interesting. I want to say that you can find all our upcoming programs on our website on the community programming page, and those links will be dropped in the chat. And again, if you would like to invest in our ability to continue offering programming like this, that link will also be dropped in the chat. So with that, thank you so much. And I hope you all have a wonderful night and stay safe.
Thank you. You as well. Have a great night and a great Juneteenth as well. Yeah.
Yes.